Hi everybody, my name is Lulu Achua. Today I'm going to be conducting an assessment on the skill on cardiovascular, peripheral vasculature, and lymphatic systems. I do not have an actual patient with me or a stuffed animal. I am just going to be demonstrating how to carry out these skills in the event of an actual patient. First, like in any other skills, I have to identify my patient with two forms of identifier, which is by asking them to tell me their first and last names, and I cross-check that with their armband to make sure it's the right patient. I provide privacy to my patients. I carry out hand hygiene. I introduce myself to the patient, and I gather my equipment. When that is done, I ask the patients some certain questions concerning the medical history, like if they've had any problems with chest pain, difficulty breathing, cough, any fatigue, cyanosis, or palo, if they've ever had issues with edema, or any family history of cardiovascular disease, leg pain or cramps, any skin changes or any sort of that. I ask them and their medication history and if they've ever smoked or they are smoking. I will also make sure I ask the person questions on if they've ever noticed or had any swelling or any lymph nodes, any enlargement or any issues with their lymph nodes, or there's any family history of any lymphatic problems. When that history is being collected, I now go and palpate the neck vessels. I palpate the carotid artery, and I note the strength on both sides bilaterally. I palpate each side separately, and then I document my findings, what I feel. And then I also have to auscultate the carotid artery. And then I inspect the apical impulse. I make sure I document if I see anything, or if the person is obese, I may not be able to find anything or see anything. I inspect for lifts or heaves. I'm sorry, I cannot pronounce that well. And I also have to do palpation. I palpate the apical impulse, and I note the location of where I'm palpating. I feel with my finger about about 4 to 5 intercostal space, and then I also have to do I palpate across the pericardium for pulsation, and I auscultate the apical pulse for 1 minute, and then I note the rhythm of the auscultation. I have to identify the S1 and S2, and I note any variation and auscultate with the diaphragm in the Z pattern. I have to identify the anatomic areas where I listen for the S1 and S2, and then those areas are the aortic, the pulmonic, and the aortic, the pulmonic, the tricuspid, and the mitral valves. So I will also make sure I repeat the sequence by listening in systole and diastole for an extra heart sounds, which is the S3 and S4 murmurs. I listen at the apex with the apex of the person's left lateral position for the S3 and S4 and mitral stenosis murmur. I also have to listen at the base with the person sitting in a sitting position, and for aortic regurgitation and murmuring. Now, I have to check on the upper extremities. In the upper extremities, I inspect the arms for the color, the size, if there's any lesion, and I do bilaterally. I have to inspect the nail beds using the profile sign, and that is also being done bilaterally. And then I have to palpate the pulses. I check for the radial and the brachial pulse. I palpate bilaterally, which is the temperature, using the back of my hand. I check the texture, I check for trigger, and then I go to the lower extremities and do the same, everything that was done in the upper extremity. I inspect the legs for color, size, lesion, if there is any tropical skin changes. I inspect the toenails and in between the toes for any toenail embedment or ingrown toenail or callus. I also inspect for, I palpate the temperature of the feet and legs. I palpate to check for edema, and I note if there is any pitting edema or no, it is not pitting. I check the tibia, the ankle, and the pedal. I palpate the pulses bilaterally to access the rate, the rhythm, and the force. And then this is done on the femoral, the popliteal, and the posterior tibia, and the dorsal pedis. Then I have to move to the lymphatics. In the lymphatic system, I will check, I will palpate for enlargement of the 10th lymph nodes in the head and neck, and then this includes the pre-auricular, the posterior auricular, the occipital, the submental, the jugulodigastric, the submandibular, the superficial cervical, the deep cervical, the posterior cervical, and the superclavicular. I'm sorry, some of these names are hard to pronounce. And when all this is done, I have come to the end of my findings. I make sure I document all what was seen, all what was discovered, and I explain what was done, what was seen to the patient. The patient has a right to be aware of everything you do, every thing you see abnormal, or even the ones that are normal. You have to let them know, okay, this was checked and it is normal. Keep on doing what you're doing, keep on taking this, keep on doing that. And in the situation where you find an abnormality, you still have the right to let the patient know that this is an abnormality. I'm going to be following up with the physician on this, and the patient is also supposed to be carried along in every situation. So at the end of everything, I inform the patient and I document my findings. Thank you.